Hi, we're so excited to present to you today. Thank you for being here. You're here to learn all about how to support children with sensory behavioural eating and drinking difficulties. I am Sophie Irwood and I will be one of your presenters today. I am a speech and language therapist specialising in dysphagia and complex needs.
Hi, my name's Heather and I'm an occupational therapist.
This video has been jointly produced by speech and language, occupational therapy and dietitian teams. It is divided into 3 modules with options for breaks between modules. We really hope you enjoy watching this video and find it useful. These are the things we will be covering today. 1. Why children can be restrictive with what they eat. 2. Understanding how to help. And 3. Some practical suggestions you can try. Not all of these ideas will be appropriate for every child, but we hope you find some ideas that you want to try. Remember, just because one idea doesn't work at one point in time, it doesn't mean that it's not worth trying again. Sometimes these ideas will work better when the child is a bit older. Children learn to like foods by having exposure to them. They learn to like food based on its taste, texture, and how it looks. Children prefer sweeter tastes to start with and need a bit of time to get used to bitter and sour tastes. This is normal. Children need to have lots of experience of trying new foods. Research suggests children need to be exposed to a new food between 10 to 20 times before they decide whether they like a food or not. Lots of children go through a phase of disliking new foods, being picky, or refusing foods that are presented in a new way. This is part of typical development. For example, moving on to lumpy textures can be tricky for some children. But some children have extreme difficulties with eating and continue to be restrictive with what they eat, and continue to choose the foods they will eat based on its visual details as well as its smell. This presentation is aimed at parents, carers, education staff, and others working with these children. This leads us to thinking about why some children can be restrictive with what they eat. So what is a sensory behavioural eating and drinking difficulty? Well, children have difficulty accepting and eating foods that have a certain texture, smell, taste or look. Their diet will be limited and they may be viewed by others as being a fussy eater. They may only eat specific brands of foods or certain flavours or types of food. Those subtle differences between different brands that we wouldn't notice, to them might be hugely different, so they may need to have a specific brand of chocolate spread or a specific brand of bread. They may only eat one colour of food, so we've had children before that have only eaten white or beige foods, such as chicken nuggets and chips. They may only prefer to eat dry foods. They may only eat certain foods from one particular food group, like carbohydrates, for example. They might not eat lumpy foods and everything has to be smooth. They may need to have the same texture on their plate, so they can't have mixed textures mixing in. They may like their food to be separate and not touching when on the same plate, or arranged or cut in a certain way. There will be lots of anxiety around mealtimes for both the child and the family. And these difficulties can impact on lots of aspects of life and be really stressful. For example, joining in at family events like going to a restaurant or going to a birthday party will be really, really stressful and really emotional. These children are often seen as being picky eaters. However, it is important to identify the underlying cause in order to help the child to build on the food they are able to eat in order to gain the right nutrition from their diets.
So we can think about performance by breaking down the factors in the environment, the occupation, this is the task or the goal, and the child. When we get a good match between all these 3 circles, then we see good performance or success. If they don't match up, then we see the child struggling with the occupation or the task that they're trying to do. So the first circle is the environment. So when we think about feeding and meal times, there are lots of different factors in the environment that can impact. This includes the physical, sensory and cultural environment. So the physical environment includes things like the seating and the table, where the child's sitting, are they in the right size chair to sit well? Sensory factors may include like the smells or the noise in the environment. So the dinner hall, for example, or a restaurant might be very different to the amount of noise that you might have at home or in a smaller room. The second circle is the occupation. So this is the task or the activity that the child's trying to do. So different tasks have different expectations. For example, when we're eating, is it finger food that the child's expected to eat, or do they need to use a knife and fork? Is it a family celebration with lots of social demands, or a snack at home with a familiar routine? Different types of food will also have different types of sensory properties. So wet and sticky foods like mashed potato are very different to eating dry foods like crisps. The third circle is the child. So the child has their own skills and abilities, what they find easy and what they find hard. So this might include lots of different skills like fine and gross motor skills, their ability to cope with sensory input that we'll talk about later, their communication and their understanding. Children also have their own likes and motivations, which they're really important to them, and this can really help them to engage with an activity. So when the three circles all match up and the demands in the occupation, the environment match with the child's skills and abilities, we see good performance or the goal being achieved. It's important to remember that it's often easier to change the things in the environment or the occupation than the child. And we always need to kind of keep a mind of what the actual goal is. So what are we actually working towards? And then what are the factors within the occupation, the task that we're working on, and the environment they're going to impact.
So we've just mentioned about goals. Goals are really important as they help to focus us on what the difficulties are related to a particular task or something the child's trying to do. And then we can think about specific strategies that might be the most useful to try. We know that for children who are restricted with what they eat, this impacts on lots of different parts of their lives. It's more than just about what the child eats and how many foods they will try. It impacts on family meal times, makes things like going to a birthday party or family gathering stressful, and it impacts on what the child would eat at school. Having a clear idea of what the goal is really important. So you might want to pause the video for a few minutes now and think about what goal is important for your child or the child you're working with. Is it about trying a new food, or is it about attending a family gathering or managing to eat some lunch at school? Sometimes it can be really useful for parents and staff at school to discuss goals so they're working towards joint goals. By identifying one or two goals, we can then think about the reasons why the child is finding that task or that activity difficult, and this can help us think about what would be most useful to try, rather than becoming overwhelmed with trying too many things at once.
We can think about behaviour like an iceberg. What we see is on top. That's the child's behaviour, the small part of the iceberg at the top of the picture. But underneath, the iceberg is much bigger. These are all the reasons for that behaviour. This might be a concept you've used before, and it can be really helpful to understand why the child might be refusing certain foods, as this can then help us to work out which strategies might help.
So this is an example of an iceberg for a child who's refusing food. So we can see at the top of the iceberg, above the water, there's multiple behaviours, lots of things that we might see the child do when they're refusing food. So that's the small part of the iceberg that we can see. So underneath is a much bigger part of the iceberg, and this is all the reasons for the behaviour, so why they're doing the behaviours that we see. So in this example, the child maybe is fearful of the food, struggling to understand social rules, for example in the lunch hall, and also struggling with sensory input, for example noise or getting their hands messy. So these are just some ideas of things that may be impacting the child. Each child's iceberg would be individual to what they're struggling with and why they're finding things difficult. So there's no one right answer, and there may be some things that you're not sure on. So sometimes it can be useful to do the iceberg with another person who knows the child. So doing the iceberg, it doesn't need to take too long. You can just take 5 minutes to think through what might be going on, and you can always come back to it again. So you might want to pause the video now and think about what your child is finding difficult. Try and think of a specific behaviour or maybe the goal that you had identified earlier and why they're struggling with this. Just take a few minutes. As we go through the session, you might think of other things that you want to add in. And at the moment, just try and keep to the reasons why and not move on to strategies. We'll come to that later.
I'm now going to go through some of the common causes of these kinds of feeding difficulties, starting with past negative experiences with eating. Some children who were born prematurely would have had to have been fed through a tube through their noses in the very early stages. And their early experiences with people around their faces would have been really uncomfortable and invasive. They would have had to have had tubes passed down them, taped to the sides of their faces, really, really uncomfortable. And as a result, they may have missed out on the early weaning experiences and exploring different flavours and textures at critical times. This may lead to them becoming hypersensitive and having limited positive mealtime experiences. Another example is children who've suffered from reflux or lots of gastrointestinal issues. Lots of babies suffer from reflux, and tube-fed babies unfortunately are more likely to have reflux due to the tube causing the valve at the entrance of their stomach to remain open, and this makes it more likely for stomach acid to creep back up. Being sick is unpleasant, but stomach acid in your throat can burn and be really painful. Some children may have intolerances or sensitivities to certain ingredients or foods, and this may have made them feel unwell and associate that feeling unwell with whenever they eat, and this can also lead to aversion. Some health conditions or medications, so for example, some medications suppress appetite, whereas others might increase other uncomfortable symptoms like the reflux that we've already discussed. And of course, choking. So if you've had lots of experiences really early on with choking and having difficulties breathing, and that being a regular experience in your early relationship with food, it's no wonder that you'd be nervous around food as you got older. We will discuss social communication difficulties and sensory processing on the next slides.
Children with social communication difficulties can have difficulties in this area. Some of the features I'm about to go into might be seen in children with these difficulties. For example, children with social communication difficulties, they like routine and they dislike change. They may eat some foods or only foods of a certain colour, or they may only like to eat in a certain place, for example, under the table or in a corner. They may have specific rituals, for example, eating in a particular order. They may count their food. They may need to have the same plate or same cup every mealtime. They might have different rules for different places, which can be confusing to people that are working with them or supporting them. For example, at school, they may only eat one food, but they won't eat this food at home. They can find new things challenging, and trying new food would come into this. They can focus on the detail rather than the whole picture. For example, if a biscuit is broken in the corner, they will not be able to eat this because they do not see it as the same biscuit because that corner has changed. If food's touching on the plate or if a sandwich is cut differently, this also can impact on whether it's eaten or not. They may dislike getting messy, and as a result they may avoid wetter or stickier textures because they don't like how it feels, not only in their mouths but also on their hands. And this also refers to sensory processing, which Heather will go into in more detail on following slides. They may be over or undersensitive to certain tastes or smells or sounds. So for example, they might like really strong flavours and crave these, or if they're undersensitive, they may go for flavours that are quite muted and not strong at all. They might go for particularly crunchy textures. They may also find noise really overpowering. So the dinner hall at school, for example, might be really stressful for them because there's lots of noise, lots of smells, lots of people packed in really tightly and really closely. If they're undersensitive as well, they may stuff their mouths with food or keep food in their cheeks, called pouching, just so they can get that feedback and that sensation. Or they may even need to take larger mouthfuls in order to initiate a swallow. They might not feel hunger, pain or thirst or temperature in the same ways that we do, or they may not be as motivated by food, and they may prefer to eat to a schedule provided by the parent rather than whether they feel hungry or not. And lastly, they can have difficulty understanding social situations. So they may refuse food that they've seen their parent preparing for hours and hours. and they may do it in a way that the parent might find it hard. Eating in a restaurant might be challenging because they don't understand the social cues of remaining seated, not taking food off other people's plates, not inducing vomiting post-meal, not using cutlery or eating off of the floor. It's important to consider that different presentations of the same food can be received differently. Take a look at this slide now and the different ways that you can present a slice of toast. Think about how well done your toast can be. So for some of us, we might like it, barely toasted at all, not much colour on there. For other people, their preference would be near burnt. Attention to detail and difficulty with change is characteristic for children and people with autism or social communication difficulties. And the way the food is presented or positioned on the plate, or even the packaging, may dictate whether it's eaten or not. So if your child is refusing a food that they would have normally, have a think about the following things. Has the positioning of the food on the plate been changed? Is the food over or undercooked by their standards? Are there bits on it? Is there some piece that's broken in the corner? Have they spotted that the packaging has changed? The logo may be a different colour. Is the box damaged? Have you brought a different brand? These to us do not seem like a big deal, but for a young person with social communication difficulties or autism, these seemingly tiny changes could actually be massive and be an absolute deal breaker.
So we're now going to think about sensory factors which we know often impact children who are restricted with what they eat. Sensory processing is the process of taking in sensory input from around us, making sense of it, working out what is important and responding to it. We have 8 sensory systems. We have vision, smell, taste, hearing and touch. They're the 5 that most people are aware of. We also have our vestibular sense. This is the sense of movement, moving up and down, and the same sense that makes us feel dizzy when we spin. It also helps us balance. Then we have proprioception. This is the feeling of where our body is in space, so we don't need to look at our hands to see feel where they are. We will talk more about each of the senses shortly. Our last sense is a sense of interoception. Interoception is about understanding the feelings inside your body. There are receptors located throughout the inside of our bodies in areas such as the stomach, hearts, intestines and bladder. These receptors gather information from inside our body and send it to the brain. The brain then uses this information to figure out how we feel. Are we feeling hungry, full, too hot, too cold, feeling sick or need the toilet? We then use our cognitive skills to interpret these sensations to work out what we are feeling. This is something children learn to do. For example, if you wake up feeling sick, you may work out that you're actually feeling anxious about something and you're not feeling unwell. Once our bodies have worked out how we're feeling, we then do something to change this state, to get ourselves back to a regulated state. So if we're feeling hungry, then we have something to eat. If we're thirsty, we have a drink. So children can be over or undersensitive to different senses. We can think of our sensory systems like a cup. This is an analogy. It's an easy way of understanding this very complex subject. So some children may have a small cup. This means they only need a tiny bit of stimulation before their cup is too full. This means they're oversensitive to the sensory input. It sets off their flight, fright and freeze system, the part of our nervous system that tries to keep us safe, and means they are on high alert. Some children have a big cup. This means they need lots of stimulation before it's full, so it's not full enough. This means they're undersensitive to the sensory input. When thinking about over and undersensitivity, we look for patterns of behaviour to help us understand if the child is over or undersensitive to certain sensory inputs. Some children can also tell us about how they feel, and we can get a lot of understanding directly from the young person. It can be quite complex to understand, but it's good to remember that each sensory system has a different size cup, so you can be oversensitive to one sense or an undersensitive to another, and you may not have a problem with some of the sensory senses. Our ability to cope with sensory input can vary day to day and throughout the day, depending on factors such as how tired and stressed we are. It's also important to remember that children can present with a behaviour for a variety of reasons. We have to be a bit of a detective to work out the reason for the behaviour, and we're going to talk about using the iceberg approach later. Children may not struggle with any or all of their senses. We will briefly go through each of the senses to discuss behaviours that we might see that suggest a child is over or undersensitive. Hearing. If children are oversensitive to noise, then a typical level of noise is too much. They may struggle to hear instructions or be very distracted. This could be noises that other people don't notice, like the humming of a fan. We may see them trying to avoid noisy places, like running out of the canteen or restaurant. They may try and block out the noises by covering their ears, putting their shoulders up over their ears. They may make lots of noise themselves or hum as a way to block out the noise. Children who are undersensitive to noise may not seem to notice noises. They may seek out or make lots of noise themselves. Vision. How we see the world. Children who are oversensitive may struggle with bright lights. They may squint or cover their eyes in sunlight or if the lights are too bright. Certain types of lighting may be difficult for them to cope with. Fluorescent lights can be particularly hard. They often also emit a low hum that can be very distracting for children who are oversensitive to noise. They may get very distracted by people or things in the environment or light coming through the blinds, and they may struggle with busy environments like supermarkets and canteens. They may notice very small changes to objects such as foods and notice that the food is a different brand. Children who are undersensitive may miss important cues in the environment, or they may seek out visual stimulus by making things spin or looking very closely at things. Our tactile sense or touch. This is from the receptors in our skin. So children who are oversensitive to touch may avoid messy play or feeding themselves as they don't want to get messy. They may wipe their hands on their clothes if they do get something on their hands. They may only like certain textures of food, only eating purees or only eating dry, crunchy foods. They may struggle with lots of tasks such as toothbrushing, hair washing and wearing certain clothes. Children who are undersensitive may seek out touch. They may fiddle and feel things all the time. They might play with their saliva or food or try and explore food on other people's plates. They may not be aware of having mess on themselves or may not notice if they've dribbled. Taste and smell. These are gained from the receptors on our tongue and in the roof of our mouth, as well as our nose. These senses are combined to interpret to the food, so the taste and smell are very interlinked. Children who are oversensitive may struggle with strong tastes and smells. They may be very picky with particular foods and not like foods with strong flavours or smells. They may smell the food to check it before eating it or before avoiding it. They may notice very small changes to the taste or smell of food, for example, noticing differences in brands of food. They may struggle with smells that other people don't notice or aren't bothered by. For example, if you're wearing perfume or you've had a drink of coffee, they may find that smell overwhelming. One young person told me they could still notice the smell and taste of onion on the knife, even if it was washed and then used to cut something else up. Another young person was able to tell me who had recently sat in the room we were in. Children with very extreme oversensitivity may gag or vomit at certain smells or tastes. Children who are undersensitive may seek out flavours. They may also present as very picky with what they eat, seeking out strong flavours. For example, one parent told me their son used to like to drink the water from the bottom of the salad in the restaurant. We worked out that it was the sour taste of lemon that he was seeking out. Children who are undersensitive may seek out non-food objects to eat and smell. They may not notice strong smells or be bothered by the smells that other people would avoid. Our vestibular sense is a sense of movement and the sense that we use to balance. This sense comes from our inner ears. Children who are oversensitive may get distressed if they're moved quickly or when they're lifted up. They may dislike things like swings and roundabouts. They may be fearful of heights or struggle to climb and dislike lifts. They may avoid moving and could appear lazy. Children may struggle with too much head movement, e.g. they might... Our vestibular sense is a sense of movement and a sense we use to balance. It comes from our inner ears. Children who are oversensitive may get distressed if they're moved quickly or when they're lifted up. They might dislike things like swings and roundabouts. They may be fearful of heights, struggle with climbing and dislike lifts. They may avoid moving and could appear quite passive. Children may struggle with too much head movement. For example, they might struggle with hair washing with their head moving back and forwards. They may get dizzy very easily and may feel sick. Children are undersensitive to vestibular input, may move and fidget a lot. They may struggle to stay seated for activities and may lean onto objects or other people. They may seek out movement like spinning, jumping or swinging. They may also be clumsy and trip over quite a lot. Proprioception is the sensory information we get about our body and where it is in space. We get this information from our muscles and our joints. We don't need to look to see where our hand or our foot is. We can feel where it is. Children who are oversensitive may have poor coordination. Children who are undersensitive may also struggle with coordination and grading their movements. They may also need to look to see where their body part is. For example, needing to look at their hands when doing up buttons, or missing their mouth when they feed themselves. They may drop things or often bump into people or things in the environment. Children often seek out sensory input, so leaning onto people, objects, squashing into small spaces or climbing. Children who are undersensitive may not notice they still have food in their mouth, or they may stuff their mouths with food to get more feedback. Interoception is about interpreting feelings from inside your body to work out how you're feeling and then what you need to do about it. Children may be undersensitive and not notice signs and signals from their bodies. They may not realise they're hungry or thirsty and forget to eat or drink. Children can be oversensitive and feel overwhelmed by the different signals from their body or find them very distracting. Children need to use a lot of thinking and cognitive skills to learn to interpret the signals from inside their body. It's a developmental process. Some children may not have the skills to be able to interpret and understand the signals and need support and prompting to ensure they've eaten, drunk or not getting too hot or cold. So we're on module 2 now, understanding how you can help. So, the expectations of food can be really important to consider. Have a look at the food presented here. The frogs, the mealworms, the green pasta and the banana with ketchup. How does this make you feel? Do you want to try it? For children with sensory behavioural feeding difficulties, they may be very wary of food. It might look fine to us, but they may feel it looks or smells different to what they were expecting. They may notice small differences in food that we cannot see. They may only eat certain brands of foods. It can be really helpful to remember how we feel when we see food presented that we wouldn't expect. Everything is a grasshopper. So you might want to pause this video now and read the short story called Everything is a Grasshopper on the link, which is written by a parent who, when travelling abroad, was offered some food she'd not tasted before, and she's reflected on this experience and how it helped her think about food from her child's perspective. Steps to Eating is a useful tool developed to help break down all the steps that are involved with eating. Only the 2 steps at the end are actually eating. All the other 30 things to work on are the steps towards eating. Children will be on different steps for different foods. So they may eat crisps, they may be able to touch oats and cereal, and they may be able to look at fruit when other children are eating it. It helps us to set realistic expectations. It's based on systematic desensitisation, so gradually becoming more used to and less fearful of food. We need to work at the child's pace and not to try and force them to move through the steps. The steps to eating can be a really helpful way to think about small goals. Where might the child move to next, and how can we present opportunities? For example, encouraging the child to empty unwanted food at the end of the meal into a bin is a way of them interacting with it. It's also helpful to think about steps such as spitting out. It's important the child knows how to get food out of their mouth safely, so teaching the child where they can spit food can be really useful. Kids may gag or vomit because they don't know what to do with the food when it's in their mouth and they don't want to swallow it. We can show them how to lean forward and let it fall out or push it out with their tongue and to spit it into a tissue or bowl. They will then learn that they do not have to swallow it once it's in their mouth, which may mean they are more willing to put the food in their mouth in the first place. So, looking at these tasty snacks of some crickets, grasshoppers and mealworms, where do you think you would be on the steps to eating with these foods?
These are some of the things that we've seen in the past that, in our experience, don't help. Forcing them to eat something they don't want, it makes them more fearful of eating and less likely for them to trust you around food. Likewise, hiding or disguising food or trying to trick the child into eating something they don't like. If the child discovers you've tricked them, they may stop trusting you around your food, and this could mean they stop eating even their safe and preferred foods. Withholding their favourite food in an attempt to try to get them to eat other things. This is actually counterintuitive. If the child stops eating their favourite food, you risk them becoming more limited in their diet than they already are. And likewise, offering preferred foods as a reward. You won't get this food until you eat this one. This just increases anxiety and makes things far worse. Remember that progress is likely to be slow and frustrating, and we really appreciate that, and we know you're probably already at your end of your tether. Try to acknowledge all the small steps the child is making, and you, and remember they can go backwards sometimes, and that is okay. These are some examples of some strategies from the Steps to Eating programme that we spoke about earlier. A spit out pot. So having a spit out pot beside their place setting, they can spit into without any drama. Think about how important it is for you to get rid of food that you don't like or that isn't pleasant. For example, when you get a gristly piece of meat, we have to spit it, don't we? Children are often happy to touch food when it is going away from them, into the bin, for example, rather than when it's coming towards them. Very often in a food session, nothing will be touched until tidy up time. Then all will be touched, and actually, this is good progress. So it's a good idea to have a bin for tidying away uneaten food. So what can we do to help? Desensitising children to the different smells and textures of food in a fun and safe and supportive environment helps to prepare a child for eating and developing positive experiences with food. Remember to build up gradually and think about how stressful it can be when you're scared of doing something and how you need that task broken down for you. It may be public speaking. You're not going to tackle speaking to a crowd of hundreds of people before presenting to smaller groups first. This is the same for our children. This is a fear around food, and we need to approach it sensitively and in stages that are easy for them and achievable. Make it play, make it fun and silly, and try to distract them from what they dislike about it. Remember to make sure that you're having fun yourself, because if they can see you having fun, it's more likely that's going to have a knock-on effect and they're going to feel at ease enough to join in with the activity with you and enjoy it. Make sure that all the items that you're putting out are okay and safe for the child to eat. By adding non-edible things like glitter or uncooked pasta, the child may put this in their mouth, and then you're having to discourage them from doing that because it isn't safe. This provides mixed messages and it can be really confusing for the child.
Messy play. Encourage without forcing the child to explore different textures with both their hands and their feet. Sometimes children are more likely to touch things on their feet first. Try doing messy play while sat at the table or on the floor.
Use a play mat or a plastic shower curtain to protect everything in your home. Some families prefer to do messy play in the bath, and this keeps everything contained, and it means that everything can be washed away once the play is finished. Start with dry items initially, and then once they're tolerating playing with a range of dry textures, you can move on to wet ones. On the next slide, I will give you some ideas of different foods to use for messy play, depending on what level the child is at with the different textures that they can tolerate. Model playing with the texture. Squish it, prod it, crush it in your hands, throw, smell, pinch through your fingers, or let the item run through your fingers. Label what you're doing and comment on it using really simple language if your child is working at an early language level. If the child appears anxious around the mess and won't touch it, that's okay, and that's why we're doing this. Encourage them to use a spoon or toy to touch the food to start with. They may feel more comfortable touching it through a bag or resting their hand on your hand as you touch it initially. Remember, we are not expecting the child to taste the food at this stage. We just want them to play with it and feel comfortable around it and get used to touching and smelling different textures. You could try hiding toys the child likes in the texture. You could put trains in a bowl of cornflakes or plastic dinosaurs in custard. Encourage them to find the toys. And have fun with messy play and be creative. You could make faces out of food or make scenes. So like the picture on the right, you could have broccoli for trees or biscuits as dinosaurs and beans for lava. Try not to make the play all focused on the characters eating. Some of this is okay, and often it's really tempting to run with this, but if the play is too focused on this, it can put pressure on the child to eat the food and make them feel like there's an expectation that they're going to have to put something in their mouth by the end. Try not to clean up and reach for the wipes immediately, no matter how tempted you feel. Encourage the child to tolerate the mess for a short time and gradually aim to increase this. If this makes you feel uncomfortable, that's okay. For lots of people, messy play makes them feel uncomfortable. Try doing it in the bath instead. That way you can wash the food off straight away. But remember, if we're not at ease, the child won't be at ease either. Some ideas now of different textures you can use for messy play. So looking at this table here, it moves from left to right, starting with the easiest textures, moving all the way to the most challenging. So starting on the left, some firm and dry textures. These are easiest because the child has more control when touching these kind of textures, because they don't require any brushing or wiping to remove any residue, because there isn't any residue. So things like marzipan, broken pancakes, licorice, raw vegetables, these kind of things are really good to start with. A step up from this would be soft and dry textures. So these mostly fall away, but some bits may stick behind, but you can remove them by gently brushing away. So icing sugar, cocoa powder, oats, sherbet. And the next one, so wetter textures. This is getting more challenging now. So the wetness will remain on the hand when they take it away from the play, but the child can break contact with the texture easily. It just requires a bit of wiping to remove. And lastly, wet and sticky textures. So we've got some nice ideas there on the right, but I wouldn't move to these until you've worked through the other stages first and the child is absolutely comfortable. This is because these textures will stick to the hand. There's less control over them because they are so sticky, and you will need to wipe your hands repeatedly to remove the residue. And this can be really uncomfortable for someone who really doesn't like having fingers in their hands. So the hardest textures there, you've got some melted chocolate, ice cream, tin spaghetti, chocolate spread, lots of ideas there.
So thinking about sensory strategies. Unfortunately, there's not one set of strategies that work for all children. We need to think about the goal and why the child is struggling. Do they have difficulties with over or under sensitivity that's impacting? So we can think about the environment and the occupation, that's the task that the child is carrying out. Could they better fit with the child's sensory needs? For example, if the environment is too noisy, could they sit somewhere quieter? Could they sit in a different part of the dinner hall? Would wearing ear defenders help? Can the task be changed to reduce the demands? So if the child doesn't like getting their hands messy, can they use utensils, or can they have a wipe so they can clean their hands? Can they have opportunities to explore and play with different textures of food outside of meal times? If the child is seeking out sensory input, it might be helpful to have opportunities to move built into meal times. For example, helping to set up, wiping the tables, or having time to do some physical activity before mealtime. It's important to use sensory strategies alongside other strategies such as visuals to help the child know what is going to happen, as this will help reduce their anxiety. It can also be helpful to use the child's interest to help engage them with the mealtime or playing with food, as this may mean they're more motivated. It's going to keep their anxiety lower and will help with their overall regulation. So, Module 3, what can you do? So we're going to think about ideas you can try. There's not one set of strategies that are right for all children. We need to go back to the iceberg and think about why the child is struggling and which strategies might support them. Meal times and eating may already be very stressful for you and your child, and it's often helpful just to pick 1 or 2 ideas to try for a few weeks. Trying too many new things in one go is not likely to be helpful for you or for the child. Some strategies we discuss might not be suitable for your family or the setting, so think about what will work for you in your routines. So, trying new foods. So we're going to think about some ideas for presenting new foods to help the child get used to the food. This will help them move along the steps to eating, which we've discussed previously. So one example is that you could, in the main room where the child normally plays, you could place a plate with some new food. So you could put this on a side table, and the idea is to put this out every day. So this could be a bowl with some orange segments or some pieces of apple or some cereal. And you can model eating the food from time to time. Try not to direct the child to look or touch or eat any themselves. The idea is for the child to learn to feel safe with the food out and explore it in their own time. So another idea is that each meal you could offer the child a food that they don't usually eat and place it alongside something they will eat. It might be that you need to put the food on a different plate to start with so you don't contaminate the food they like until they're more used to it. Again, avoid putting any pressure on the child to touch or eat the food, just encourage them to tolerate it being there. You can also try offering new foods in new settings. Sometimes children are more accepting of trying new foods out of their usual context or routine. The tasting plate. So new foods can also be offered at meal times, and you can put them on a separate plate, and they can be in addition to the preferred food that the child has on their own plate. The tasting plate could be placed in the middle of the table, or it could be on the side of the child's main plate. There should be no pressure to try the food, but lots of praise if they do choose to touch, smell or taste it. Offer a new food consistently at each meal time or snack time. Sometimes the child may be happy to serve someone else the new food. This is an opportunity for them to move along the steps to eating. Family-style dining and eating together can be really useful. This is where the food is placed in the middle of the table and each person serves themselves, or they can serve each other. This can provide opportunities to see the food and interact with it. It means the child can have control over what they put on their plate, but still have opportunities to get used to the food. It can also provide opportunities they may be happy to serve other people the food, so still interacting with it and moving along those steps to eating. It's really important to think about expectations and what are realistic small steps. Don't expect the child to go from only eating Weetabix to a full roast dinner or a full school dinner. Children often feel safe with particular sensory aspects of the food, for example, the look, the texture, the smell. It's their way of protecting themselves from feeling overwhelmed. One strategy that can be useful is to try introducing a new food that is similar in terms of the sensory properties to the food that the child already accepts. For example, if the child will only eat Weetabix, try offering them Ready Beck or porridge. If they will only eat Tesco's white bread, you could try with Sainsbury's white bread or Tesco's white bread roll. Remember to acknowledge and celebrate all the small steps forward. So food chaining is another opportunity to introduce new foods. So food chaining is a way of moving from one food to another using foods with similar properties. So in this example, we move from McDonald's French fries to a different size of McDonald's French fries, to oven chips, then homemade French fries, sweet potato fries, potato wedges, then baked potato to mashed potato. So this would take quite a lot of time. This is just an example that can be used. So if you can offer choices and get your child involved in deciding which food they could try next, that can also be really useful. And it may take many times of consistently trying the same food before you see progress. Keep trying and don't give up, and remember those steps to eating. With each new food you need to go back to the bottom of the steps to eating and start from there.
Food scrapbooks. A couple of ideas depending on the age of your child. You could, with a younger child, try making a Yum Yum food book, and this is a record of the foods that they currently eat, and you have different pages for foods that they currently aren't eating but they may be more willing to explore in other ways. They may lick these foods or touch these foods. And then you'll have pages for foods that the child doesn't eat. And you'll have Velcro on these pages so that the pictures of food can move between the different pages depending on the level that they're at. So, for example, a child might start with broccoli on their touching and licking page, and then over time it might move to the food that they like page. It's a nice visual record for a younger child. And then you could try making a learning about food scrapbook with an older child. And this is a way of exploring different but similar foods to the ones that they're currently eating. And to do this, you cut out photos, pictures from magazines, pictures from the internet. You may wish to use actual food packaging and labels. And you start by focusing on a food that the child currently eats and stick that in the middle of the page. So that might be Tesco white bread. And you find other pictures of brands of bread, different shapes of bread, flavours of bread, etc. And you talk to the child about the differences and similarities between them. So they're all bread, but this bread's round, this bread's brown, this bread's white, this bread's seeded, this bread comes from a different packet, it's from Asda, this bread's cut into slices, this one has fruit. You get the idea. You could go on and on. There's millions of types of bread, so that'd be quite a big page. And you can make different pages of different fruits, forms of potato, different crisps, trying to explore the foods that the child currently is a bit reluctant to explore, but trying to find similarities between those and foods that they currently eat. It links back to the food chaining we were talking about earlier. They're going to be more likely to want to try a food that's similar to one that they already try than one that's completely different. And as I've touched on already, this is more appropriate for an older child because they've got more language skills. They can understand, firstly what similar versus difference means, and they've got more language to be able to have that conversation with you and explore it with you. Laminated dinner mats. This is another nice visual strategy, and it's a way of keeping track of all the foods your child has tried. So rather than it being focused on foods that they're eating, it's a record of things that they've tried instead. So you can make a laminated dinner mat like the one you can see here, and you cut out some photos or symbols or food labels of different foods. And remember to have a mixture of foods that the child will eat versus some that they don't currently. And then when a child tries a food, you stick it on their dinner mat. And you encourage the child to gradually fill up their plate. It's a nice positive and visual strategy, so it's less focused on the ones that they like. It's more sort of rewarding them in a way for being willing to try those foods. And you can take that placemat with you to other places as well, and it's a nice record for them and a nice thing for them to be able to share with other people. Here are some other ideas for you to think about that you might find useful. Pretend play with food and tea sets. You could have a teddy bear's picnic with your child's favourite toys. You could encourage the child to feed the adults or their toys. You could even sit the child's favourite character at the dinner table for meal times, and they may spontaneously start trying to feed that character. We find that being part of the whole food journey from shop to table can make the child more likely to try a food. So you could try choosing a simple recipe together that you can make, go to the shops together, choose those ingredients, and then come home and prepare and cook it together. The child might want to mix the cake mixture or roll out the pastry or cut out biscuits for Christmas cookies. You could use different plates and bowls or cutlery that relate to the child's favourite TV or Disney characters. So you can see a Paw Patrol plate there in the middle. And sometimes plates with separate compartments or motivating messages also can be really helpful, particularly if a child doesn't like their food touching. A Try Me chart is a slightly more condensed version of the steps to eating that we talked about earlier. So you can use this to help the child tolerate new foods, but avoid using this at a meal time. It's best to do this at snack time and stop if the child shows any signs of distress. So you show the child the chart and you model the steps for them first, and you do it with a food that you know the child's found safe and is able to eat and happy to eat. So it might be chips, for example, or crisps. And as you go through each step, you move a picture of the food you're eating along these steps. So you move between smell it, touch it with your fingers, kiss, lick, bite. And then when they've achieved all the steps, the child can stick this food on a I can eat chart or one of the other visual charts that we've talked about already. Give your child lots of praise. Good eating. You're eating chips. Using lots of intonation and facial expression. You could also reward them with bubbles or stickers or singing a song. And then once your child has gone through this with a safe food, you could encourage them to do the same with a more challenging food. Remember to model the steps for your child first. And if they don't manage to go through all the steps on this occasion, that's okay. Stick the picture under the last step they achieved and use this as the starting point for next time. So they might only manage to smell avocado. You leave the picture of the avocado under the smell it, and then you start at this point when you do it next time. Providing structure is important so the mealtime routine is predictable and reduces anxiety as much as possible. You may wish to have some relaxation before a meal so they're in a calm state before the meal even starts. This could involve massage, meditation, calming music. It helps to have visuals before and during the meal so the child knows what to expect. For example, now and next boards, as you can see here on this slide. Now we're doing lunch, next we're doing drawing. This helps to reassure the child that the meal will end at some point, but make sure the next activity is one they will enjoy so they're more motivated to move on to the next step. Another example here on the right, you can see a menu of what is for lunch today, or breakfast or dinner. Let them know in advance what they'll be offered and when, but make it visual. If it's visual, it can appear as a rule, and this can help with some children because they may be more willing to try if they feel like it's a rule. Particularly children with ASD, this is something that can really work for them. So these strategies are really important because it makes the mealtimes positive and the child more likely to eat. It lets them know in plenty of time what's going to happen, and this helps reduce anxiety. Try to have your mealtime structures in the same way every single day. So if you're going to do relaxation, make sure you do it every day. Try to do it in at the same time, in the same place. More of the same equals less anxiety. So I know it feels like extra work, but actually you're more likely to have things run smoothly if you can provide structure and make things as predictable as possible.
Managing your expectations, and we appreciate this really isn't easy, but be aware of your own reactions and anxiety and try to manage them as much as possible. Unfortunately, when we're anxious, no matter how much we try to hide it, how we are feeling will come out in our behaviour, our tone of voice and our facial expressions. Anxiety feeds anxiety and can contribute to negative associations around mealtimes. Think about how you respond when they don't eat any lunch. Are you constantly cleaning up every time they make a mess? Try to remain calm and focus on what the child has achieved. Unfortunately, there are no shortcuts, so be prepared for a bumpy ride. The child may eat a food for several months and then decide they don't like that food anymore. But continue to offer this food as the child may start to eat it again at a later date. They will only make progress at their own pace and on their own terms, so follow their lead. Putting pressure on them just causes the child to feel more anxious and less likely to make those positive steps forward.
Food diaries can really help you to see what, where and when the child is eating, and it may help you to find a pattern. You might actually be surprised by how much your child is eating. Try this for just 3 to 4 days, and if necessary, if you feel still really anxious about what your child is taking in, then it can be useful to discuss this with your GP. Remember, no food is bad, and while we all hope to provide a nutritional, well-balanced diet for our children, for some children it's more important they eat something rather than focusing whether they are meeting their 5 a day or not. This may mean that schools need to make reasonable adjustments and consider what they can do to help balance meeting a child's needs with healthy eating guidelines. And don't be afraid to ask for help. Looking after a child with eating and drinking difficulties can be really frustrating, lonely and extremely worrying. It is important that you acknowledge and share these feelings. Roles and responsibilities. Remember, you can control what and how you offer the food, but the child at the end of the day is in control of what they eat and when. It is useful to remember that when a child is choosing not to eat a food, they are communicating about how they are feeling. And going back to goals, we want you to think back now to the start of the presentation when you thought of your goal. What strategies have we talked about today which may help you achieve these? And going back to our iceberg, what 1 or 2 strategies are you going to try? If you are worried about your child's eating, you could always speak to your child's GP or another health professional that's already working with them. You could also speak to the school or the nursery to find out how they're managing there, because sometimes there may be differences and it's useful to share these with each other. If you have made a list of foods that your child is eating or done a food diary like we've talked about, it is helpful to bring this to appointments if you have done this. And now it's time to give it a go. Remember just to focus on the 1 or 2 strategies you have chosen for now. And remember, just because something doesn't work at one point in time, it doesn't mean that it never will. It is sometimes worth trying these things again when the child is a bit older or in a different frame of mind that day. We really hope you've enjoyed this training video. Please do ask your GP if you have any concerns regarding your child's nutrition. Thank you for listening, and we wish you all the best.